Greetings and welcome to the Police Treatment and Community Collaborative's next conversation with the field, focused on the importance of data and deflection software. Those who are working in our field of deflection and pre-arrest diversion, who are helping sites get a better handle on data and evaluation and understanding what's going on and how to do it better in their deflection and pre-arrest diversion through the provision of software. Today's conversation with the field, hosted by PTACC, is super exciting because it represents for us as a growing and emerging field in the United States, responding to issues of addiction, of mental illness, of homelessness, and a variety of issues that our communities face, that we have now companies that have said, there's so much going on here. We want to be in this space. We want to support the development of deflection and pre-arrest diversion. And we want communities to have the most powerful tools possible available to them to understand what's going on, to look at their data, to evaluate it, to be able to report out on it to the public, to be able to show that deflection is making an impact, to address issues of race and equity, diversity, to look at gender and make sure we're doing the right uptake there, to make sure that all the things that we know are important as core values to deflection are also being attended to. My name is Jack Charlier, and I'm the Executive Director of the Police Treatment and Community Collaborative. We are the national voice of and nation's knowledge leader for the field of deflection and pre-arrest diversion. I welcome you here on behalf of PTACC. You're going to have a great conversation with the field. As you will hear Jonathan, our moderator, say today many times, this is a conversation. We want you to send in questions through the chat box. There'll be a short presentation on the 4 wonderful companies full of very trusted and respected colleagues, all of whom work in this field, that are going to share with you the software they have available to you. But we want you to be part of this. Speak up, get your questions in the chat box. This is a conversation with you as the field of deflection and pre-arrest diversion. Finally, before I turn it over to Jonathan, I want to thank you for the work you're doing each and every day across our countries to help our neighbors in need who are facing issues of addiction, of mental health, of homelessness, as we address the issues that they face, their families face, their children face, and also for us in deflection, that we are looking at honestly and with integrity the issues of racial disparity and equity, and making sure that we are part of the solution in how we design our initiatives, including the data we look at, and change and modify what we're doing so we're addressing that. Welcome today. We've got a great conversation with you, and I invite you to join PTACC through the PTACC newsletter at ptaccollaborative.org. Sign up for our newsletter, which is the weekly email newsletter for the field of deflection and pre-arrest diversion. Thank you again for being here, and I now turn it over to our exciting moderator for today, Jonathan. Jonathan, over to you.
Thank you so much, Jack. My name is Jonathan DiCarlo, CEO of C4 Consulting, a division of C4 Recovery Foundation, one of the sponsors of today's events in collaboration with PTACC. Welcome to the Conversations in the Field. Data matters. We're going to spend a few minutes playing a series of videos from some of our participants, and then open up for a dialogue where we invite you to submit all of your questions during the video and throughout our discussion into the chat window, and we'll address them to our panel and give everyone a chance to respond and engage. We'll make this invitation numerous times throughout our discussion. And at this time, we want to make space to take just about 20 minutes or so to share some videos on the content of why data matters.
You got to share your sound, Jim. When you share your screen, you got to click enable share computer sound.
Where would that be, my friend?
On the screen share sub menu on the right, there should be 3 little dots. You click on that, and then below it should say share computer sound.
All right. Just a second. Where are you? Here you are. Okay.
You can actually do it when you share your screen. So if you click share screen and it asks you what you want to share, which portion of your screen you want to share, in the bottom right of that is another location with a checkbox that says share computer sound. And don't worry, Jim, I forget to do it all the time. You can ask my cohort, Jordan. I literally do this every call. So no, no harm, no foul.
Okay, let me just see here. This is it.
We appreciate you bearing with us as we get our technology functioning correctly.
Okay. Okay. Am I unmuted?
Yes.
All right, so we're gonna just listen to it the only way we know how at the moment.
And I'm with the Civil Citation Network. Today, I'm going to be going over some basics about pre-arrest diversion, and I'm going to walk you through a little bit about the software platform that's available online for clients to help manage their pre-arrest diversion process in a seamless, easy-to-use platform. So when you start to look at the total cost of incarceration in the United States, research tells us that you get about an $80 billion number that is poured into our correctional system every year. And when you look at the amount of individuals coming out and cycling right back in, you get about 45% recidivating right back into the system. So what are the options for us to reduce the number of people coming in by arrest and creating some criminal justice reforms with positive outcomes? Across the country, you got national groups, national associations that support arrest alternatives that lend to positive outcomes. And it's not just in one section of the country, it's happening in different states and different programs with different types of programs starting up. But when you dive down into it, you start to understand that all of these programs have three core common threads through them. They promote public safety, they hold individuals accountable, and they reduce recidivism rates for the criminal justice system. So based on this knowledge and based on 50 years of experience helping criminal justice systems implement different alternatives, our principals founded Civil Citation Network in 2013 to help different jurisdictions manage, track, and evaluate their alternatives to arrest.
The question I'm asked most is, why are we doing this and what do we hope to accomplish? Having been involved in the criminal justice system for over 4 decades, you realize very quickly that there's a better way to do this. There's no need to arrest everyone, especially a low-level misdemeanor, when there's better alternatives to provide services. And that's why data is so important. If we can demonstrate this on a wide scale, have that data, do the evaluation, we can fundamentally change the criminal justice system for the better. The other question I'm asked is, how does technology help you? Now think about this for a minute. If you're setting up a pre-arrest diversion program, there's no data system in existence that can identify these people and track them, provide the array of services they need, provide the case management, specialized services, provide the outcome data, and provide law enforcement, state attorneys, and the key players with the effectiveness of the program. And that's what this system does.
CCN platform is a cloud-based, customizable solution. From opioid diversion to care coordination and even pre-arrest diversion, this software solution can be customized to any community's needs. Officers on the street can search and query results within 30 seconds. They can issue new diversions from the system itself and automatically submit those diversions up to the program administrator for approval.
Well, from a law enforcement perspective, officers can search past diversion and issue new ones in a matter of seconds. The more streamlined the diversion process is for law enforcement, the greater the buy-in. It has to be easier to divert than to arrest for a program to be successful.
It's never been easier for administrators to review, approve, and assign a diversion to a local community provider
all with a few simple clicks of a button. Using permission-based roles allows case managers to view and see only the cases that are assigned to them. Once the case is found, timeframes, tasks, and due dates can be assigned to the diversion plan that's viewable to the participant's role. Within the diversion plan, tasks can be customized to your program's needs. Case managers can select from predetermined tasks or add new tasks that are individualized for each participant.
Tracking data using the old school method of updating Excel spreadsheet and constantly keeping up with the newest version is time consuming and tedious. What used to take me several hours putting together a program report and managing a pile of paperwork can now be solved with a few simple clicks of a button.
Now, there are additional optional program features that can be tailored to your unique program's needs. Secure payment integration can be activated to your platform and safely connect with your Stripe account to collect your client's payments online. HIPAA compliant video conferencing is also available, which will allow case managers to work face-to-face with their clients remotely in a safe and socially distant manner. When this feature is enabled, case managers have the ability to approve, decline, or reschedule meeting requests from clients with ease. With this additional telehealth feature included in your platform, you'll have all the tools required to manage and execute diversions from start to finish.
As a program manager, I have the ability to get that information in real time and make decisions quickly that will ultimately benefit the participant in our program. Being able to connect virtually has almost eliminated my no-show rate for appointment. It gives participants an easy way to connect with me and complete the diversion plan. It also allows me to communicate with all the other stakeholders and share data with them in real time.
Upon the successful completion of the diversion plan task, the case manager will submit the updated status to the program administrator for their review. The administrator can then verify that all diversion tasks have been completed, and now it's time for their final stamp of approval. Once complete, your agency has the option to send the client a customizable completion letter to keep for their records. And just like that, your program's diversion process is complete, saving you time and money for your organization. Well, that's all for now. With plans starting at $250 a month, you really can't afford to miss out on this opportunity.
Okay, next.
Welcome. As you know, both fatal and non-fatal overdoses represent one of the most pressing public health challenges facing the United States in decades. Police, in partnership with their healthcare and recovery partners, have a front row seat to this crisis. In your efforts to implement effective community-based solutions, there is often a technology gap that hinders effective strategies. We thank you for taking a few minutes to learn more about SIMS, or the Critical Incident Management System. The information presented will describe SIMS, including its key functionality and distinguishing features. We hope you find that SIMS will meet your technology needs as you lead your communities to a better tomorrow. SIMS was developed by Kelly Research Associates, a research firm based in Massachusetts that has done extensive work with police departments across New England in their efforts to combat the opioid crisis. SIMS was developed in partnership with local police in their efforts to adopt more deflection and diversion-based approaches to substance abuse and related problems. The system was designed specifically to support multi-jurisdictional policing efforts that involve innovative partnerships between police and their healthcare and recovery partners. SIMS is a proven product that is currently operational in more than 300 police departments, involving more than 750 police officers across New England, with over 20,000 incidents and 12,000 follow-up records entered. Wow. This is a fully scalable software that can meet your technology needs. SIMS is a web-based platform that does not need any specific technology to run it. It is a cutting-edge technology solution built on Amazon Web Services. With AWS as our backbone, SIMS can take advantage of the most current technology and security solutions to ensure it is always operational. SIMS integrates the Federal Information Processing 140-2 encryption standard to ensure your data is protected. The FIPS 140-2 standard is both HIPAA compliant and also consistent with most states' encryption standards for the transmission of criminal history data. We are here to protect your data. SIMS is a flexible software solution that supports both deflection and diversion, or lead program models. The software allows participating agencies to document and track deflection or diversion incidents and document post-incident response strategies. SIMS also provides an optional behavioral health module at no additional cost. In many communities, behavioral health calls for service are often 2 or even 3 times higher than overdoses. SIMS provides a flexible framework for implementing similar collaborative-based approaches to these problems as well. So whether you're implementing deflection, diversion, or even behavioral health program models, SIMS is the tool that will work for you. And it's important to stress, SIMS was designed specifically to support the engagement of police in these areas. So, what are the features of SIMS that distinguish it from the rest of the market? SIMS allows participating communities to share relevant data about overdoses and related problems with police and non-police partners directly involved in community programming. We've found across New England that anywhere from 20 to 40% of overdoses are multi-jurisdictional problems. That is, individuals overdose in communities other than where they live. Multi-jurisdictional problems demand multi-jurisdictional solutions. SIMS allows participating agencies to share real-time data with key regional partners. Sharing of real-time data allows for the delivery of quick and meaningful support to the people that need it most. Have you ever had a situation where you needed key information and you didn't know who to call? Or the person you called didn't know what information they could share with you? Or even worse, the individual wouldn't share the necessary data that they should. Experience tells us that it is often these very problems that inhibit important work that needs to be done to bring the people that need help the help they so desperately need. SIMS has a built-in communication hub that allows police to communicate directly with identified hospital and recovery partners. The system shares only the right data with the right people to do great work. SIMS has an intuitive, easy-to-use dashboard that allows agencies to better understand and manage their caseload. The reality is that police departments have a lot on their plate and desperately need tools to help manage competing demands. SIMS provides useful information at the fingertips of users in easy-to-understand ways. The dashboard provides instant access to recent incidents, incidents with outstanding follow-up visits, and even an incident tracker at the individual level that allows users to quickly identify potentially high-risk individuals. An important feature of SIMS is that it not only provides instant access to incidents within each user's jurisdiction, but instant access to events involving individuals living in their jurisdiction who experience critical incidents in other participating areas. SIMS allows users to do their jobs easier. SIMS also includes an optional component that allows data to be transmitted directly to ODMAP by way of an internal API feed. ODMAP has emerged as a national leader in tracking overdoses at the regional and national level. SIMS allows communities to partner with HIPAA and ODMAP to support their important efforts. Not only is ODMAP an important national priority, but many federal and state grant programs require reporting of overdoses to ODMAP as part of grant conditions. This customizable feature allows for individual agencies to opt in or out of this feature, supporting the important value of local control. Kelly Research Associates also has experience onboarding agencies to ODMAP, so let SIMS be a tool that facilitates participation in this national effort. Access to real-time data and real-time trends is critical. This is even more so the case when it comes to significant problems that are of concern for the public and for political leaders. The need for real-time data is also important because problems such as overdoses are dynamic issues that can change on a dime. SIMS provides instant access to reports that summarize key indicators of harm. The instant reports allow leaders to know what is going on, how things are changing, and critical dynamics of current events. Reports can summarize data at the agency level or the county level. The data from reports can also be exported to Microsoft Excel for further analysis or manipulation. Instant access to key reports is one of the many ways SIMS allows users to make data matter. Individuals who are in desperate need for help often fall through the cracks of systems that, quite frankly, do not communicate or collaborate effectively. SIMS provides the technology infrastructure to help communities better support their high-risk populations. For example, evidence shows that timely and meaningful engagement with individuals who overdose increases their chances of getting access to treatment. Substance abuse problems throughout our communities are more than just police problems, and they need more than just police solutions. SIMS connects the public safety community with their healthcare and recovery partners to increase the chances of getting people access to treatment. SIMS is more than just a concept. It has a proven track record. SIMS and the work by Kelly Research Associates have been recognized for supporting the important work done with the police community and their efforts to support those who so desperately need access to treatment. Both SIMS and KRA have been identified as central to best practices in Police Chief Magazine, by the Worcester County District Attorney's Office, by Plymouth County Outreach, and by police chiefs across Barnstable County. SIMS and Kelly Research Associates will be there to support you and your efforts. SIMS was developed with police to support innovative police efforts. SIMS helps make data matter by creating instant access to needed data and needed reports. SIMS meets the needs of its users in a safe and secure way. And SIMS has been identified as a tool that facilitates multi-jurisdictional and multidisciplinary efforts. So, looking for more information? Please reach out to Pamela Kelly or Sean Verano from Kelly Research Associates. You can also visit us on our website at www.simspublicsafety.com.
Okay, next.
As we get ready to load our last video from one of our collaborative partners, I want to remind everyone to submit your questions through the chat for our panelists to be able to respond to throughout our upcoming dialogue.
I'm Kelly Firesheets, and I'm with Cordata. We have a comprehensive platform that supports first responders like police, fire, peer recovery supporters as they implement pre-arrest diversion and deflection programs. I was originally trained as a clinical psychologist and came into the nonprofit and social sector industry as an evaluator and a researcher. So I've measured programs and looked for program outcomes. Probably about 7 to 10 years ago, we started to notice this trend of the opioid epidemic in the greater Cincinnati area. And so I started to focus specifically on programs that addressed opioid addiction. While doing that work, I met a group of folks in law enforcement who were collaborating with treatment providers and people in recovery to try to help move people into treatment and appropriate services instead of arresting them. In that work, one of the biggest challenges was that we couldn't find data. My favorite memory was a cop who had a desk with a bunch of Post-it notes on it. And he would color code the Post-it notes, and that's kind of how he was keeping track of people. So we started looking for a system to help us support those teams and support the work, but also to provide this bigger picture data so we could understand what was happening on the ground. And that's when we found Cordata. So the system that we're using today was designed by and for pre-arrest diversion programs. Cordata would convene meetings of folks who were on the ground doing this work every day and walk through screenshots and processes with them. And using their feedback, they built a system that is simple enough to meet their needs, but also has the ability to expand as the teams take on more or add partners. One of the other wonderful things is that in this space, we see lots of innovation and new ideas and new programs. And by collecting the data, we can share information across the programs and they can learn from each other. So it shortens our innovation curve and it shortens our learning curve. And hopefully that means we get better and we save more lives faster. So the programs can make even day-to-day decisions more strategically by using the data. And we have a feature that allows them to plan out their workflows so that when they go out in the community to meet with people, they can plan their visits so that they're not driving all over the place. Just very simple things like that. It also helps them to look just at overall data and trends to see how long people are engaged with the team or how often on average they're able to contact people. Those types of information help them plan for staffing and workload and to understand what they need to be effective and what the right amount of support is to get people the help that they need. The Cordata platform is HIPAA compliant, which allows us to store these data as if they are health data. We keep them just as secure as people's electronic medical records. So Chief Synan and I met about 5 years ago as we were starting the Hamilton County Heroin Coalition. And we came into it with really different perspectives. I was a researcher and an evaluator, and he was a police chief. But the one thing that we actually agreed upon was that we really wanted to see numbers. And we would go into meetings and we would ask people for data, and we would ask to see data, and we would ask people to share data. It was not popular, to be honest with you. It was not a popular request in the beginning. But we, kind of over time have pushed and worked to build collaborative relationships so that people can share data. And I'm really proud to say that in Hamilton County with the coalition, we now have a really robust data profile, both to understand when overdoses are happening and where they're happening, but also to understand what's happening on the ground to respond to those overdoses and how effective we are at getting people connected to treatment.
Hi, I'm Tom Synan. I am the police chief for the village in Newtown, and I am also a co-chair for the Hamilton County Addiction Response Coalition. I've been the police chief here in Newtown for going on 28 years. I got involved in the addiction crisis after I seen an entire family here in Newtown die from addiction. The mother and all 3 of her sons. Looking out my window, I can see the grandmother that's raising 5 of the grandkids. 3 of the 5 are struggling with addiction themselves. So that kind of led me to helping to put this a little bit more out in the public, addiction itself, and can we do things differently? And so back in 2014-15, began the Hamilton County, what we call the Heroin Coalition, but is now the Hamilton County Addiction Response Coalition. And the thought being, could we bring community members that were part of the addiction solution and also the addiction problem, bring them together around a table, and could we work on more longer term resolutions to deal with addiction, not only save lives, but get people connected to treatment and longer term care. The other part of this that's really key is data. You have to have data, but I'm going to reframe data. We have a ton of data. We have data from every different angle. I get 6 different reports. And I think a lot of times when people go into joining or building relationships, connecting networks, connecting resources, the first thing they always say is, I need data. Well, it's not a matter of do you need data, do you have actionable data? Can you use what I need, and vice versa? Do I have data that you can then use to enhance your program? If another police chief came in and asked me, why would I be interested in Cordata? I would tell them that it allows you to connect you to other services. We in law enforcement aren't the answer to resolve addiction. It is a chronic mental medical health condition. So we don't have the tools and knowledge and resource to do it. So if you have a system like Cordata, what it does, it brings all the resources into one system. So now you're able to communicate with other systems. And what you're really doing is you're building a coalition off of actionable data. So even if you're all not sitting at the table talking to each other, because you're sharing that information, because you're sharing that data, because you have access to certain information, and it can be filtered in different ways, they know that you're connected to the system. And from a police chief side, from a law enforcement side, now I can now communicate with my quick response teams, my law enforcement diversion, my court programs, with hospital systems. What you did is you built a system. So you as law enforcement, if someone's not going into the jail system, if someone is just overdosed and you brought them back, you know they can get into this continuum care model system, this collaboration, and you can then follow all the way through the progress. And if someone falls out of the system, you know where they fell out, you can put them right back in. So Cordata gives us the opportunity to mesh systems that it's already working in, the criminal justice system and the healthcare system. And if we can bring both of those together with Cordata, what it does is it transitions addiction out of the criminal justice system. So instead of punishing those addicted, we can actually legitimize addiction as a chronic mental medical health condition and treat it as such.
So at Cordata, we've learned that it's not just technology or software that makes change. You really have to have good, strong collaborative programs. So we provide software, yes, but we also provide a lot of support to help programs and people become successful. And that might be consulting services, that might be help setting up a team, that might be connections to other resources, like national experts, things like grant writing, evaluation support, all the things you need to make your project successful, because if the program itself isn't successful, none of us are. So the best way to start is really to see the software. So we can schedule an appointment to show you the software and then have a conversation about how to make it work for you and fit in your program.
Okay, now. Last but not least.
And one final reminder.
What is the PTACC compensation?
One of the things we always talk about is we have this front row.
Sorry. Go ahead, Jonathan. No? Okay.
What is the PTACC compensation?
One of the things we always talk about is we have this front row seat in law enforcement. We could be a great resource of information for our behavioral health partners.
What's our purpose? Our purpose is to save lives.
My name's Scott Allen. I'm the Chief Operating Officer for Operation to Save Lives, a program of Community Services Solutions, a division of Homeland Security's Incorporated.
Our sole purpose with our system here is to identify incidents on the front line through police, law enforcement, fire, EMS-led initiatives, so that we can identify the problem and then share that information with our outreach teams, but and as importantly, with our healthcare treatment providers. And that's really what this system does.
I'm the retired Chief of Police from East Bridgewater Police Department in Massachusetts. I spent over the past 25 years in law enforcement. The only tool in our tool belt for law enforcement for substance disorders was investigative tools. We didn't learn in 1995 in the police academy about substance use disorder as a disease. So my career path, in this world of deflection, pre-arrest diversion, first started in 2012, volunteering with a local substance use coalition, and it just evolved from listening to moms and dads, fellow community residents telling me about the tragic stories in their life and what the opioid crisis had done to them.
In 2012, I created a drop-in center at a local church, and the idea was to connect people to care. And that's what we really want to talk about when we talk data, is we can connect people to care because of the program. The data tool is only as good as the program that's there to support it. And that's really the big lesson that we want to share, with this audience, is that you need to have the program infrastructure in place and the collaboration, the relationships that build partnerships that lead to true collaboration, public safety and public health collaboration across the board. And then we can implement these tools, and we have a great, what we call a front-end tool that we've devised based off of our frontline experience, responding to overdoses, naloxone reversals, and then engaging those family members and loved ones and sitting there at their living room couches and kitchen tables and sharing with them the resources that exist. We want to be able to capture that, and that's what this system helps you do.
This is definitely in a new arena for public safety, for law enforcement specifically, working in collaboration with a lot of public health experts, treatment providers, hospital networks, people in recovery, families in recovery, the churches, the schools, all these different entities that make up what a community looks like. It can all be different in every community, but we didn't know what we needed. To me, the biggest realization moving throughout the years, the more volume and the more people we engage with, the harder it was to maintain connections. We were losing, because we were using paper and pencil. We're using spreadsheets and a computer. We were losing the ability to get back into the work. I'm not going to take people away from the purpose to give me data, to pull up data, to pull up statistics so I can tell a board or convince a council that I'm doing good work. They have to trust me, and I have to build those relationships. But we didn't know what we didn't know until we were already kind of deep in it and going, oh my gosh, what do we do? Where do you go? Who do you raise your hand to? How do you search the internet to find a partner that's willing to help us in this collection of good information to help us better understand what successful recovery looks like?
What we're about here is really working with our community partners to share the lessons learned that myself and my colleague and partner here, Dan Malloy, are going to talk to you about today in the deflection pre-arrest diversion field. It's personal for me as well. I've lost a family member to substance use disorder, and I have many, unfortunately, friends and family members that have experienced the issues with substance use disorders. My evolution from retiring as the police chief in East Bridgewater led me to meeting my partners here at Community Services Solutions. And what we've done is we put a team together based off our experience as a retired police chief who helped create a model in 2015 in Plymouth County, Massachusetts, that's now a national mentor site for substance use disorders and pre-arrest deflection diversion work. I was the lead agency for our county model with the Bureau of Justice Administration, the COPE grants, which are now the COSAP grants, of which many of you may be recipients of. So I have that frontline experience. And now in my private sector career here, I'm looking to share those lessons learned. Through PTACC, I had the great fortune of meeting retired Coleraine Township, Ohio Police Chief Dan Malloy. When he and I first started talking in the past year about this pre-arrest diversion, deflection passion that we have, I felt like I was talking in the mirror, to myself. And with that, I want to have Dan introduce himself to our team today.
Thanks, Scott. This is exciting. It's always an honor to work in partnership with really good people that have big hearts and great vision. My background, of course, is in law enforcement and public safety. I served more than 29 years in local government, police officer, police chief, the epicenter of the opioid crisis in the early 2010 era of time. And we were not operating with that mindset of problem solving, not working collaboratively together. As Scott said, we had one tool in our tool belt, and that was to react and then utilize the system that was in play to reduce the harm. And it wasn't working. And the reality came really smacked in front of us in the 2012, 2013 timeframe when people were still dying, families were still being lost, neighborhoods were being destroyed, and our communities were suffering. And no matter where we went as leaders, someone would raise their hand and say, do we have a problem? And if the answer was yes, which it was, what are we doing about it? And we always felt early on that the answer was somewhere related to more arrests, more seizures, more task force involvement, more street level drug operators, more plainclothes, all these different things that we've been utilizing as an answer for generations when it came to law enforcement and drug activity. It just wasn't the right answer. We enacted what we call the quick response team, and that's a collaborative effort of really great people that are willing to do things differently and challenge that proverbial status quo to save lives and families.
Our key partner on the research and analysis, Dr. Carol Gregory, focuses on the analysis piece, identifying those underlying causes of substance use disorders.
I'm Dr. Carol Gregory, and I'm a PhD criminologist. I have over 25 years of client-based experience in evaluatory research, grant writing, policy analysis, curricular development, and instruction. I support the O2SL data platform using rigorous research methodology and content expertise to provide valid, reliable, and defensible metrics, reports, presentations, and proposals. I'm available to provide your project with consultation remotely or in person to support your needs.
We don't forget that every data point on a map of an overdose or an overdose death represents a son or a daughter, a mother, a father, a sister, a brother, a loved one. We can connect people to care because of the program. And we have a great, what we call a front-end tool that we've devised based off of our frontline experience, responding to overdoses, naloxone reversals, and then engaging those family members and loved ones and sitting there at their living room couches and kitchen tables and sharing with them the resources that exist. We want to be able to capture that, and that's what this system helps you do.
Thank you so much for joining us. And at this time, I'd like to open with an audience question and invite the audience to participate by submitting questions through the Q&A and through the chat for our panelists to answer and respond to. The opening question that our panelists will respond to is the following. In the space of deflection and diversion programming, how does data connect people to care? And as our panelists respond, they'll introduce themselves with their organizations.
Hey, thanks, Jonathan. This is Jordan Cowart with CCN. Really, I think what you heard from the video is, how do all these tools really help programs connect to care. And really at the end of the day, the program has got to have partnerships, and that's partnerships from law enforcement, that's partnerships with other stakeholders in the community. And because there's no, the technology itself is not an end all be all, and the program has got to sustain through those partnerships within the community to help those individuals connect with the services, because at the end of the day, that's what the software is trying to do, is help connect that individual and relay that information to the providers so that they can make real-time decisions to help the client at the end of the day.
Excellent. Thank you so much. Would others like to weigh in on that, or did Jordan really hit the nail on the head with that?
Jonathan, I'll just add a few thoughts. Really, there's four really key ways why. The first thing is that you have to know when problems happen. So measuring the problems when they occur, sharing the data in your real time. These are very dynamic issues. We're dealing with people in crisis, and there's a need for a real-time data sharing part of that. But it's not just sharing data with just police, although that's a critical part. It is really creating a capacity for police to share that data with their non-law enforcement partners. This is a collaborative, community-based work. And, I'm sure with my police chief colleagues right on this call here will say, police cannot do it alone. And so how does the software really bridge those two worlds? The fourth part is to know what happens. Hold our program models accountable. We're dealing with at-risk people that fall through the cracks of our helping systems. And what our software really needs to do is to be able to know what work needs to be done. Police are busy enough as it is. So know when problems happen, share data, and know what happens as an outcome associated with the important work that we do.
Thank you, Sean and Jordan.
I would just, go ahead, Kelly.
I think Sean said something really important that I want to highlight, which is that people fall through the cracks, right? We talk about people falling through the cracks. And what I love about pre-arrest deflection and pre-arrest diversion is that these are programs that connect systems, multiple systems. And he used the plural, systems, right? They're not, so these folks' success, they're really at risk. They're at really critical points, life or death situations a lot of times. And their ability to be successful and become healthy relies on their ability to be successful in multiple systems at the same time, sometimes the same moment. And that's freaking challenging, right? And so the data systems and the programs that support these people have to sort of be the bridge between these different systems so that people can move between different systems and among different systems, and the information can go with them.
And lastly, Kelly, I'll just follow up on that. It's the ability to alert those community support groups without being redundant across all of the sectors, because at the end of the day, for each individual person who's in need of being connected to care, their story is going to be different than the next person. So the ability to connect to all of the different support groups in those systems is really the critical piece in all of this. And at the end of the day, it's the tool that you need a tool, but it's that designated program that's set up that will really create the model.
Thank you so much, everyone. And a follow-up question submitted by the audience. Given that the theme of this event is data matters, based on your experience, what kind of data matters in the space of deflection and diversion programming? And how does your software position communities to actually make that data matter?
So I guess I'll jump in again. I mean, obviously, we touched on real-time data and having law enforcement as kind of the tip of the spear, being able to have access to that information so that they know in a pre-arrest diversion space, how many diversions had a participant on the street at 2 a.m. actually have before. If they have that person in front of them and they have access to the information, they know if they've had 1, 2, 3 diversions or maybe not any bites of the apple before. That's just one scenario, in an overdose situation. If it's a reoccurring patient that's in front of you, maybe they've had Narcan before, maybe this is the 6th, 7th time they've seen them. You know, maybe have access to what hospital they were at previously. I mean, just having access to the information, you know, in a real life situation, I think it's critical, and especially for law enforcement. I know, our technology is built on partnerships. And so the example that we give is, we dealt with the incarceration crisis 20 years ago with juveniles in the state of Florida being arrested for misdemeanor crimes. And if you're able to head this off at the pass like we did 20 years ago, you're able to see the results of those interventions taking place in their lives, because it's going to drive down that recidivism. And so your long-term effects of, a prevention and intervention type scenario with law enforcement at the beginning being able to issue a pre-arrest diversion, at least for juveniles, you're seeing those effects 20 years down the line. And so, that's really just one example of how, the interaction between law enforcement, the community partnerships with community service providers, behavioral health service providers can really impact individuals' lives, both juvenile and adult.
And I'll jump in if I can, Jonathan. This is Pam Kelly from Kelly Research Associates in the Critical Incident Management System. I think our experience is you want to make sure that the data is purposeful and it's not just a data collection exercise. No one wants to just collect data. Sean and I are researchers, Kelly's a researcher, and we love it. We're data geeks, but in dealing with these sorts of programs, you really want to make sure that your data is purposeful. So when we were developing SIMS, we really worked with a team of police officers to talk about what data elements were really critical for them to know about overdose events and doing post-overdose follow-up visits. And then which of those elements were readily available on a police report or a follow-up report. So it's a data collection system that's easy to use. It takes about 2 to 3 minutes to enter an overdose. No one gets frustrated that they don't have this information. So it's easy at the front end. And then it tells the story of the program on the back end. So you're able to really evaluate and analyze this data to really tell the story of what your program is doing. You want to be able to illustrate your achievements, of course, but you also want to be able to identify where your obstacles are. And programs certainly don't want to waste time or resources on strategies that aren't working. So you want that constant feedback that data can provide you so you aren't wasting time and resources. And you want to be able to have that achievement story that you can tell. A lot of these programs are grant funded. So you probably have reporting requirements. So you want to make sure that the data you're collecting is also responsive to those reporting requirements and your local goals and objectives, whatever you have set up for your program. So you want to make sure that you're able to be responsive to many different people who are going to want data from you. And then of course, sometimes the most important thing is this data allows you, by telling your story, to apply for other grant funding and to be able to bring resources into your program and expand and grow. So that's my take.
So when I think about data, I don't necessarily think about data, but I ask questions. And I think there are 4 key questions you want to ask yourself kind of when you're thinking about what data to collect. And the first one is, Pam hit it on the head, what does my funder tell me I have to report, right? Like, you got to start there, right? Because you got to pay the bills. We all like to eat. And if our funders are paying the bills, we want to give them what they want. So that really is question number 1. And then you go to, what does success look like for me, right? How do I know if my program is effective? Is my program operating efficiently? So you want to have some pieces of information in there that help you understand how efficient you are, how to improve your program efficiency. And then for the individuals, am I doing the best I can for this person, right? Because at the end of the day, we're trying to help people. So you want to know, who is this person? What are the important things about their history that I need to know to maintain a relationship with them, to continue a relationship with them? And I think if you can answer those 4 questions, if you have information points that address those things, you have data that speak to the overall effectiveness of your program, that help you run your day-to-day business, and then also, that pay the bills. And so those are kind of the important pieces, and I think the right framework to think about data.
Just to add a few more things, when you get into the meat of this, I mean, we have a very robust intervention deflection system that these people go into, where there's an evidence and science-based tool to evaluate them. A biopsychosocial, we develop specialized treatment and our intervention plans. There's a whole array of services that's made available that we track these people through and try to measure at every turn, following up on the important elements of what we're trying to accomplish. And how effective are we? Now that's to me is the single biggest thing that we have to grapple with. People want to know, show me, is this working or not, or is it just another social service program that's trying to be a do-good? You have to demonstrate that. When we set up our program, we were lucky enough I'm sure we all know who Al Kopak is. He's done the longitudinal studies for our program that now go on for 7 and 8 years. And we can demonstrate that effectiveness. And we've got a well-defined program. We measure every aspect. And like I alluded to kind of earlier in the introduction, is that if we can prove that we're effective, we've got a better model, we're going to substantively change the criminal justice system for the better. And that's kind of what I think we're all shooting for. And until we can prove that, we've got a long way to go. And that's where we're at. We want to make sure that when we're effective, we're able to identify that, define the reasons for that, share that information, and constantly work with all the other players that you see here to improve our system and make it better as we go. That's an element that's been missing in the criminal justice system.
Jonathan, if I may jump in here, Dan Malloy, Director of Operations at 2SL. Kelly said it, Tom said it, Pamela said it, effectiveness and efficiency. But from the field, effectiveness and efficiency means what day of the week are we going out if we don't have a full-time team? What's the best opportunity to engage? What's the time frame? Time from overdose to first contact to engagement to access to whatever resource or treatment it looks like. When we were working with paper and pencil, we realized that if we made face-to-face contact with you within 3 to 5 days of the overdose incident, we were going to move people to treatment 80+% of the time. I wanted to know, what do 3 days look like? I want to know what 5 days looks like. If 3 days is great, what's 2 days look like? But we didn't have the data because we didn't have any place to get it from. And I was one of those leaders in Hamilton County, Ohio, that told Kelly, I don't have time for you. Stopping the work, it impacts people's lives. If I'm not on the street doing the outreach, people could be dying. They're suffering. I don't have time to pay attention to numbers because I got people waiting for assistance. So we had to learn along the way what was more efficient, what was more effective. And the only way we can really do that is know what's experienced from the front line. And getting that frontline information from those first responders, those police officers, those firefighters, those paramedics, because they're the ones that Sunday night at 7 o'clock in the evening, or Christmas Day at 10 a.m. They're working. It's a 24/7 business. We don't want, if I learned one thing over the last 7, 8 years, is this is a 24-hour a day, 7-day a week, 365-day a year problem. But we can't be open just 8 a.m. to 4 p.m. We can't just be available at one particular time. We have to be available to get information and learn from it and then operate from that, make decisions. And in public safety and law enforcement, we call it data-driven decision-making. We get the information, it allows us to be better, be proactive. Oh my gosh, I've got a 46 square mile community, but I don't have a 46 square mile problem. I have a problem that's in 4 residential blocks, and I need to be proactively engaged with community education, fentanyl strips, the lock zone, all those kinds of things. We can be proactive and engage with that. So the data, we need to have it to be able to respond to it and understand what that means. So we need that frontline access. And that's something that I know Scott, Al, and Mike built up when they created their system, was understanding that we need the frontline information. We can't wait for it. So again, we want to be efficient. We want to be effective.
Jonathan, I'll actually just follow up on that too, because I think Dan and Kelly really said 2 interesting points. First, I'm Sean Verano. I'm a senior research associate with Kelly Research Associates, and we developed the critical incident management system. What Dan pointed out is the need to be able to know those questions. When do overdoses occur? What's been the time lag? And really for SIMS, we really develop a dashboard to really, because I think those data points are so important. And as Dan's pointing out, police are doing other work. They're not sitting around waiting for work. So you need those tools. And what SIMS really does is that it integrates those tools to know those very questions. Kelly also really mentioned the idea, again, of working with at-risk groups. And one of the ways that we really want to just point out is like SIMS data gives you new starting points. So one of the questions that happened with SIMS is where data started to really build out the program model was what the system tracks how many overdoses a person has had. And the question that the police chiefs asked the very first time that we presented data is that if I know this is somebody's third overdose in the last 30 days, does this change the kind of intervention that I'm actually supposed to do? And so what happened is that the team we were working with developed an entire new grant program under the COSAP/grant co-funding to develop a tier 2 intervention model. But until you know that this person's had 3 overdoses in 30 days, you can't do anything about it. So really SIMS provides those data points that allows not only police departments to manage the workload that they have, but to ask and answer those really important questions that not only position it to go get more money, but as Scott had said, these are people's mothers, these are people's sons, right? To really connect people in meaningful ways and to use police as a facilitator for that. So we would say that SIMS really helps to fill those gaps that really everybody said here.
Thank you so much, everyone. And really great points. Being able to tell the story, being able to measure success, being able to track those community collaborative partners in the process are some of those reasons why. Being able to really impact care, and as Tom and others have pointed out throughout, really being able to shift the conversation and the driver of how care gets integrated into public health and public safety. So I invite everyone participating to, again, submit your questions through the Q&A for our panel. Our next question comes in. It says, is it really worth the time and energy to collect data on pre-arrest diversion and deflection programs, right? And we just started to tap in, so zeroing in a little bit more on what Dan had said and what Sean was pointing out to. So why is it so important? And is it worth the time and energy to do so?
So Jonathan,
I was going to jump in and say no, absolutely not. It is not worth the time and energy. Of course it is, or we wouldn't be here, right? Like, of course we believe it's worth the time and energy to collect the data, but I think it's worth the time and energy to collect the right data, right? And I think that's worth pointing out. I'm sure all of us here have examples of folks that we've talked to in programs where like there's a lot of data, but they aren't the right data, or they don't come back to you in a way that they mean anything. And so I would say, if it's not meaningful, it's probably not worth your time and energy, right? The data you collect should inform and be informed by the work that you're doing. And you should be working with people who understand that program and the value that the data can bring to the program. Otherwise, it actually might be a waste of time.
So to Kelly's point, to me, it's the right thing to do. But to Kelly's point is you've got to know what data you need to collect. And the example I'll give you is if in substance use disorder is a disease, if any one of us has a disease like cancer, what do the medical experts do? They gather the information they need to know to make the proper diagnosis so that they can then treat that person and get them to remission. It's the same idea here with substance use. It is a disease. So we need to be passionate, show compassion, show we care, but then we need to identify what is the actual disorder for this specific individual, and then what's their path going to look like? Because in this evolving field of deflection, there are so many different pathways. And I used to get asked all the time, well, what do you think about, all these different pathways, Chief, 12 steps, MOUD. I'm not the expert there. What I am the expert is doing is using that front row seat to then connect them to the experts that can do that diagnosis. But to do that diagnosis, to Kelly's point, you need to collect the right data. And I think that's something that in the field, we've really learned to do well, relying on our experts, which really goes back to that collaboration. This cannot be law enforcement alone. It can't be fire EMS alone. It is public safety and public health coming together, intersecting, and then coming up with that action plan based off of the experts.
Excellent. Thank you so much. Another question that comes in, and something as a practitioner myself that I certainly look at and ask of folks like yourselves as collaborative partners. So there are a lot of free tools out there to collect data and it being the right data to collect that's meaningful, useful, and impactful, why should someone pay for a data system in pre-arrest diversion or deflection programming?
Jonathan, I'll be happy to jump on that. I really think that that's a great question, and that's a fair question. I mean, we all have all public servants have an obligation to do the thing that's fiscally right for their communities. So the first thing, and certainly, Pam as the executive director might not like me saying this, if the tool that you have works and it works well, awesome, great, go with it. But what we find is that the freeware programs like even just Google Sheet, Google Docs, SurveyMonkey, all of these kind of things, they are probably pretty effective at getting you 30 to 40% there, maybe sometimes 50% there, but 50% is not close enough to 100%. And so while, if you want to do generic data collection and maybe some outcome tracking in a static way, what we're really talking about with SIMS is a program management tool. And there's a big difference between tracking data points and managing a program model. You really need software that maps over to the business processes that underlie what's going on. If you try to put a square peg into a round hole, we all know that peg is not going in. The second thing is that those freeware require somebody at your local end to manage it. They have to be the data experts. They have to be the technology experts. They own it until the day that they die, right? And we know that people get promoted and they move and they do all of these things. And when you have software that is people dependent, it really, and really quite frankly, that is one of the biggest, things for all programs, is programs, the backbone of a program is a person. And when that person leaves, that program model falls apart. We actually manage the technology. We onboard all your users. We handle the technical problems. We handle all of those things to let your people do the work that they actually do. Finally, you also have data security issues. I mean, Kelly already mentioned this. We've mentioned it. We have HIPAA. There's HIPAA issues. There's 42 CFR Section 2. This is serious data. You can't just use even a password secured Google Sheet, right? I mean, there's legal consequences to accessing data. I mean, there's insurance issues that you need to have if, God forbid, that your data system ever gets breached, right? So, we use Amazon Web Cloud, all of their encryption standards. You need to take, this is serious data that needs to be handled in a serious way. And I really think there's an argument for a professional company that can really take those pressures off of your lap.
Hey, this is Drew from CCN, and I want to say Sean absolutely just killed that. That's perfect. That's exactly how we feel as well. And if a free solution works for you, that's great. I think it's a positive thing. Hey, you found your solution, but when you boil it down, programs need to evaluate their scale, their scope, their goals, their objectives, before making a decision about the right way to go. And I think that's why why we're here today. When you get the care coordination aspect in regards to CCN, it's not just entering in civil citations, deflection. It's not the program administrator being able to determine if this person should pass or fail. It's everything involved. I mean, when you get the video piece in where these case managers can meet virtually with people right there on the platform, I mean, you've solved that need. And you can just kind of break it down piece by piece and see where these all-encompassing systems where you can keep it all in one place, one HIPAA compliant place, as to Sean's point, you've really, nobody will fall through the cracks. As Kelly, brought up, people fall through the cracks with these kind of basic systems. And when I say complex, it doesn't have to be confusing, right? It can be very easy to use, but that infrastructure needs to be there.
Yeah, one of the things I'll add, and this may be a bit like preaching to the choir because we're with PTACC and right, and we're all kind of in this together. But I think sometimes people treat pre-arrest deflection and pre-arrest diversion as kind of like an amateurish, like grassrootsy movement, as opposed to the emerging profession and the emerging field that it is. And so I love a good Excel spreadsheet. I mean, I really do. And I think for new programs and people who are just starting, you can get an Excel spreadsheet, get a little system going and track things, and that is perfectly adequate. But as programs mature and as the field of pre-arrest deflection matures, I really believe that this intervention deserves support and a data infrastructure akin to electronic medical records or RMS systems, the kinds of investments we make in the systems, the treatment and the law enforcement systems it's connecting to. Because again, these programs are the bridge between those systems. And so I just kind of philosophically, I think that it's important to professionalize and honestly to honor the work of the professionals doing this day to day, saving people's lives, by giving them tools that are designed to support them and designed to support the very specific types of data that we're documenting here.
Yeah, Kelly, I mean, to me, this is a tool, right? That's not, and I love the Excel data sheets because I'm a closet data geek myself, but this is about process, communication, and then information sharing. You need this system so that you can manage the program and all of the different key facets. You've got one incident that an officer, fire EMS, may have 7 other responsibilities of notifications they need to make or share bits and pieces of that information from one underlying incident. So this is a tool that's about that collaboration, but then allows you to do all of that programmatic, all those responsibilities and those key pieces, not just collecting some points and just putting them on a spreadsheet that then you're then going to do a chart on. So it's about that total program support.
Yeah, and you're hitting the nail on the head. This is no longer a mom and pop operation. This is our goal is to fundamentally change the way the criminal justice system works. If you think about it, most of the focus is on the back end. If we're not focusing on the front door, we're never going to get ahead of this problem. And that's the unique aspect of what we're doing. And to change the front door, I mean, there's an old saying that the worst door in America is the front door of the criminal justice system. What we should be is the best door. Our goals and objectives should be to make sure that people are successful, they live their dreams, they're not marginalized for the rest of their life. You go into the criminal justice system, you can't design a worse system. You're tagged for the rest of your life, you're marginalized, you're trapped for relatively minor offenses. What we're trying to do is say, no, there's a better way. Let's help people be successful. Let them pay taxes. And that's how you build a healthy community. When 1/3 of your population in the community has a criminal record, what's the impact? When that 1/3 is integrated into a healthy community and they're healthy people, what's the impact of that? It's a game changer. How do you make the world and your community a better place? By doing better things at the front door. When someone has a problem, we don't hit them in the head with a hammer anymore. We say, look, how can we help you? And that's what this system does.
Thank you, Tom. That was awesome. But again, from the front row seat is the realization that I need good information to be able to tell my story. I need good information to be able to let my community know what work is being done, how I'm impacting the problem. We still have an issue of stigma within, and it kind of relates back to what Tom just said. There's people that believe that we're not giving good time, we're not putting good money to this disease, and we're realizing that as community servants, our responsibility is to work in collaboration to solve the problems. This is a problem. We should be working together. Working together, we gather information. We need to be able to tell our story. We need to be able to do that without shutting down our operations. So, to Kelly's point at the beginning, if you're small and you have that ability and it works within this environment, then the spreadsheet works. The Post-it notes with different highlighter code, that works. What works, we don't want you to stop being successful in your own world, but the realization is this problem continues to grow and we have to be more responsive because more communities are asking us to. More people are educating themselves in the community and raising their hand and saying, hey, what are you doing? What are we doing as a community, and not just getting by with the old answers that we gave 10 years ago? The arrest and this and that is not the answer. The justice system is not the answer. I want to be able to get into the system and be able to access information without shutting our operations down. I want to be able to know what's happening because I want a true picture of what's occurring within my own community, and then the ability to share with those communities, because we know there's no fence line at the edges of our communities. We know that this is cross borders, cross states, cross communities, cross counties, all those things. So we want to be able to communicate with each other so we can all be relevant. We can all be working in collaboration, not just within our own siloed communities. So I want to be able to have the information. So number one, I can continue to educate internally as well as externally within our organizations to know that we're doing the right things for all the right reasons. And this is why, and that data is important to me to be able to tell that story.
No, thank you so much, everyone, for responding to that. And really, it is that paradigm shift that we're looking to impact through all of this information and the quality of information that everyone has shared today. We certainly invite people to continue to put their questions into the chat. But our next question comes in and says, what questions, and I'll qualify it by saying, what are the right questions that people should ask when they're looking for software or technology solutions in deflection and pre-arrest diversion programming opportunities?
I'll take that if you want, Jonathan. I think the first question is you have to ask, does it work? Does it work for us? Right? I mean, does it actually meet our needs? The problem is you have a lot of products that were developed for other reasons that are then trying to be applied to another problem. Our software was developed to manage not only overdose, but diversion, issues, also to handle issues of your behavioral health. Most agencies find that their behavioral health or mental health calls for service are anywhere from 2 to 3 times their overdose calls for service, and these are comorbid or co-occurring problems. So our software really allows agencies to kind of grow into their sort of proactive treatment first approaches. You also have to ask, is it easy to use? The reality is that we can't treat our police officers like they're case managers. They're not. So you need to give them a tool that works for them and that actually does what it needs to do. The third thing is, does it tell our story? Does it allow us to articulate what we're doing? And then the fourth is, the cost. I mean, the reality is our municipal budgets are not unlimited. And quite frankly, us as the vendors, we have to demonstrate what the value added. Here's our cost structure, and here's what you're getting for it. And that's some accountability on our part. This is for many of our agencies a serious financial commitment. And so, what is the value added of your product to actually help us do our job better? But again, we're dealing with fathers, with mothers, with sons, with daughters, getting the people that need help access to the support that they need.
Yeah, I think just to follow up on Sean's point, about the needs, what are the needs of your particular community? Because these systems need to be flexible and adaptable, because an outreach program, deflection, pre-arrest diversion program, it's going to look different in different communities. Is it urban, rural, suburban? Is it in the East Coast, maybe different from the West Coast? There's a lot of different, type of issues. What's the number one primary causing drug of your issues? Is it methamphetamine? Is it cocaine? So does it meet those needs is the first piece. And is it flexible and adaptable? Are you willing to adapt to meet our needs? Sean talked about, these cross sections. It's not just, it was built off of opioid response, but is it encompassing of all drugs issues at risk individuals? Will it address the co-occurring mental health disorders? Are you identifying drug endangered children and sharing that information to the appropriate resources? So it's really, when you're looking for these programs, it's got to meet your needs, and is it going to be flexible and adaptable? And then the last piece I'll say is, what's the support system? We offer a support system that has an IT director with a background in HIPAA compliance. We've got an experienced software team member in a leading role. You need to have that support, because these incidents are going to happen at 2 a.m. And if you can't get logged in the system, what's that customer support look like?
Yeah, one of the things.
Go ahead,
one of the
Kelly.
things I would encourage people to do is to pay attention to what questions the software vendor is asking you. Because one of the things you can see on this panel, and this is so fun for me because these are my peers, right? Is that the kind of software you want to use, you want to work with people that understand pre-arrest diversion, and deflection. Like, and everybody on this webinar has like been in the trenches of it and seen it and been in it for a long time. I know these faces from conferences and things, right? So you want to work with people that have experience, and so you want to ask them to tell you their experience in this specific thing, right? Like, if you're a lead program, have you worked with a lead program? If you're a quick response team, have you worked with a quick response team, right? If you're a civil citation, have you worked, like, you want to ask those specific questions and really understand their experience and how they can support your program as well as your software. Like, it's one thing to have, you know, customer service for your Microsoft Outlook, but it's another thing to have customer service for a program that's this complex, right? And the best vendors are going to give you both. And we're all nodding our heads because we've all been there, right? And I think, you know, you can ask those questions directly, but the other thing is really to see what questions they're asking you, because any of us would talk to a potential site and ask a bunch of questions. What are you doing? Who's involved? What reports do you need? How are you sharing data? And if they're not asking you a lot of questions and really trying to understand what your program's doing, you're probably going to be in a situation where somebody's trying to shove your program into their software and they don't have the ability and the flexibility to accommodate the work that you're doing. And so I think that expertise and the understanding of what's happening in the field of pre-arrest deflection is a really important part of this. You know, maybe even then, like, which kind of software you pick, making sure you have the right support for the program and the software.
Kelly, I think you hit it right on the head, because having that value add that Sean talked about, I mean, you're signing up for a partnership. This isn't a vendor relationship where, you know, I'm going to drop this off and walk away, because as we know, a lot of the software has started because the industry has changed, the situation, the communities changed, they're different. What works, you know, in Massachusetts may not work in Texas or in Florida. So, you know, echoing, you got to be flexible, you got to have a partner, and you also have to be tapped into what also is going on, just like what PTACC is doing. They're leading, right, criminal justice, new initiatives that are happening across the country, and PTACC is where a lot of this information is coming up, is filtering through, and so you got to have a partner that's tapped into those resources.
Real quickly, I don't want to, but my question would be, what we know today might not be what we learn tomorrow. Will you change with us? You know, what we need today might not be what we need tomorrow. Are you willing to add to the questions that we ask? You know, there's a little nuance of service looks different because it looks a heck of a lot different than it did 6 years ago, 7 years ago than it does today. And how we evolve, are they willing to evolve this? And Jordan just said it, it's a partnership, it's a relationship. It's not a PO with a check, a cash check, and then we never see that person or that organization again. And sadly, from local government, that's often what that software experience looked like for us. So, you know, we talk about trust and credibility a lot with the vendors, with the community, and we talk about this relationship. We need to understand that that may be a difficult relationship to gain within our local governments, because they're used to people that want to sell software and not work in partnership with us. And I think that's the difference between, you know, PTACC and who they've brought together and who's on this call today and who's doing this meeting, is we have a different passion, a different heart, a different vision for what service looks like and how we deliver it. So again, I think that's important, because, you know, we're changing every day. This is as Jack said it again, we're an emerging field and we're learning, and we want to be working with somebody that learns with us.
And I think if I could just, you know, follow what Dan just said, because he just said something I think is really important, is you're looking for a partner. And although we're in, and Sean and I always talk about this, that we're in this, you know, software space, but we're program people. We're professors, we're criminologists. We build programs, we work with law enforcement. We have ended it up in this space because of that work and that need that we saw for some sort of technology to support these newly emerging programs. So you really want to look for someone that can be a good partner in this process and not a vendor. And I would just really, you know, stress that as being important.
No, thank you so much, everyone. We've got just about 10 minutes left in our time today, so I want to make room for one last really important question that I think will give an opportunity to tie this all together. So I'd love for each of our partner and collaborative organizations to be able to share an example of success where you and your team have made technology and information more valuable to a practitioner set or a community that you've worked with.
So I guess I'll jump in here first on this one. A specific example that just comes to mind, we were working with a provider and, they came to us with a question about, how they wanted to track specific occurrences of events for their plan that they were developing. And so we worked with them on, a specific solution and a software feature through the platform that would basically be able to set timeframes and dates with the specific tasks that they were trying to collect, because they knew right from the ground level perspective, they were tracking it by paper, right? They were getting into the spreadsheet ordeal, trying to collect a sense or an attendance sheet of who's attending this group, right? It's that whole understanding of the workflow, how this one specific instance or request fits into their entire program model. And from their feedback and what we were able to deliver, it actually turned out better than they had expected. So it's having that understanding of the full picture, what the program's trying to achieve, and then I think being able to deliver that solution, for our situation was exactly what our partner was looking for.
Yeah, it can't be rigid. To kind of echo what Jordan said and what everybody's kind of just following down the same kind of path here. And it sounds like these other programs have this, kind of, shape shifting ability to kind of mold what the client needs. And that's very important. What we built from the onset was what we call an MVP, a minimally viable product that can be shifted at any moment to that client's needs. And I think that is of the utmost importance. It shouldn't be about, how can I say this? It shouldn't be about integrating our program with their program. It should be the other way around. It's how can we integrate what you do into our program?
Jonathan, I'll just follow up on that. I mean, talking about the specifics of how SIMS has helped communities. One of the collaborations that we worked with, really based on our data platform, been able to secure $2.6 million in funding, and that funding was those grant applications to COSAP were absolutely linked to our data. The data, the findings from the data, and I had mentioned, data gives you new starting points. The recognition of the multiple overdoses was the actual data point that where they applied for one COSAP grant that allowed them to focus on high rate people within the communities. This same community now got another level of funding to bring the county sheriff on board and to do some targeted outreach to hotspots. It wasn't until the data really started to point out that these were points of intervention that were needed. So until you have that data, you don't know what to do next. And SIMS has been identified by this community partner as the critical tool to give the data points, to apply for extra money, to get money, to enhance the overall program model, which again is focused on identifying at-risk people, getting them access to treatment, and really making their lives better. So this is really a people story, but how software really helps communities do the important work that needs to be done.
Well, thank you so much, Sean.
And, Sean, great to follow up. We talk about success. One of the success stories that we've just had is through PTACC, meeting all these great professionals, like-minded professionals, meeting Kelly and her team at Cordata and Dan's work with Cordata and QRT. What we've been able to do now with our O2SL platform is integrate it with Cordata's system. So now we have what we think is this front-end system, our frontline response system to capture incidents at the street level, but then to be able to share it and push it to the behavioral health world, to the healthcare provider system, because that's one of the challenges. It comes up all the time when these programs are starting. Is the first two things are privacy and HIPAA. We hear it all the time, continue to hear all the time. And that's one of the things that we've now done with Cordata, is figured out how to integrate those systems so that we can share information with those behavioral health experts that won't necessarily capture information from the street level. So now those referrals on the back end side of this are going to increase, and we're going to connect more people to care, and it's ultimately going to save lives. So it's just one of our recent partnerships that we're really excited about.
Scott stole my thunder to talk about fund integration. So I'm actually going to wrap up by giving a kind of smaller, really focused example. But we've got a community here in Ohio that was looking through their data from their overdose response. And what they found was when they looked at overall overdose data in the community, there were huge increases in the African-American population, specifically young African-American men. I think it's like a 400% increase, but don't quote me on that. But it's somewhere in that range. But when they looked at their overdose response data was not seeing that population. For whatever reason, they weren't able to engage that group, right? And so they were looking at the data and they saw that disparity, and they're currently working on sort of changing their program model and bringing in some specific new partners to do targeted outreach to that population where they see the increases in overdoses. I mean, that's kind of a small example. It's one community, it's one population, but I think it's a really important example of kind of how you can use data to look at what you're doing in context of your environment, and really make changes that can make a big difference, and get ahead of the problem, right? And make changes as we see things happening in real life.
No, thank you so much. We really appreciate everyone taking the time. And I'll give one last opportunity for any of our panelists to share any final thoughts before we get ready to close our time together today.
On CCN's end, I would say ease of use of your system has got to be the most paramount thing, because to Dan's point, this first point of contact, this tip of the spear, that's engaging these participants. They're not sitting around there twiddling their thumbs. They're busy. So when they get on, when they engage with the platform, whatever it may be, CCN, SIMS, et cetera, it's got to be easy and it's got to work. It can't fail. So I think that's why on the development side, having HIPAA compliant servers that are ready, that are not going to fail, that you have people kind of around the clock, making sure that when Dan finds this overdose victim or finds this guy who stole a loaf of bread in the civil citation end, it's got to be easy and it's got to work. And I think when you test a system, for all those people out there that are thinking about buying something, when you test it, it's got to be easy for you to understand pretty much right off the bat. And then that way, when you bring in these new people, right? Because Dan, he may be the police chief that sees the presentation, that sees the product very intimately before they decide to go on board with it. These police officers, these individual people have not. And how much, will it require to train them, and will they have time? So ease of use is paramount in my opinion. Thank you.
All right, well, we're coming to the close and the top of our time together. I'd like to thank everyone from our collaborative partners, Tom, Jordan, Drew, Sean, Pamela, Dan, Kelly, Scott, and all the others, Jack Charlier and the PTACC Collaborative, for being able to bring everyone together. We thank you all for your service, those of you who've taken the time to join us today, and those of you who view this in the future. We encourage you to visit ptaccollaborative.org to sign up for the PTACC weekly newsletter dedicated to deflection and diversion topics and those involved in the field. And we also want to put it out there and keep everybody reminding that our third annual PTACC conference will be coming up in October of 2021. We're so grateful for your service. Thank you for impacting the world that we live in and changing that paradigm and conversation. Thank you for coming today, and we really look forward to engaging you in the future. Take care, everyone.